I'm Michelle Bates, I'm 41 and I've got Ehlers-Danlos syndrome. I'm in a family where my children are the fourth generation to be diagnosed, so I was third generation diagnosed. But my mum and her mum didn't get diagnosed with the inherited disease until I was 18, and then it became apparent that it was quite deep into our family line and that it was a genetic condition. It's so varied because the connective tissue is the building block of the whole body. If there isn't enough of the strong part of the collagen, then your body's faulty. Every part of your body's faulty. So, you know, we have a lot of eye problems, skin problems, internal problems. It kind of affects every single part of your body that needs collagen to be strong, as is too weak. I was diagnosed at 18, having been under the medical profession since I was 7. I started off with chronic pain in my knees. My mum had had a history of knee problems and knee surgery. Medical profession wouldn't link the two up. It was kind of my problem was separate to my mum's problem. So we were very lucky that I got diagnosed by a geneticist team who took a family history, who made that link to my mum and her mum. We've had terrible trouble with rheumatology, who are our team that manage us within the NHS service. We've had to train our rheumatologist up over 20 plus years about the condition, so much so that he now gives talks to GPs and professional bodies about the condition, and he uses us as a case study as a family. GPs are becoming more aware of it because of the people are getting diagnosed much better now. We've got 4 families at school diagnosed, so when they keep saying it's a rare condition, it's not as rare as they're making out. It's an undiagnosed condition. If our joints aren't managed properly, we can have worse dislocations. So mine's resulted in too much dislocation, so that I've got really bad osteoarthritis to the point that I can't have surgery for my osteoarthritis because it's so bad. And I'm only 41, but all my bones have matted together through the arthritis due to not having the support when I was younger. I didn't have arching soles to support my hypermobility in my feet. I haven't been, my joints haven't been properly managed, supported at a younger age. I'm lucky that my children were diagnosed at 1 and 5. I was 18, so I'd had a lot of damage done through the medical profession, not really taking my pain seriously when I was younger. I've had ambulances called out for dislocations. I had a severe, really bad shoulder dislocation that resulted in my shoulder blade being fractured as well. I fell up a step, put my arm out, and my shoulder came out. At that point, when I was 18, I wasn't diagnosed, but I'd always had problems. Last year, I had an ambulance called out twice for cardiac problems. My GP thought I was having a heart attack because my heart was racing and we couldn't get it under control for like ages. So an ambulance crew were called to get me to the hospital. We were more concerned that they'd never heard of a connective tissue disorder. And obviously we wanted to make contact to just say that as lovely as the ambulance crew were, we were concerned that this is a condition that they weren't aware of, and it doesn't just affect us in one way, it affects us as a whole body, internally, externally. Okay, so if an ambulance crew came and a patient says they've got Ehlers-Danlos syndrome, it covers such a wide variety of problems. It causes joint hypermobility, which results in subluxes and dislocations. Most of the time we can put them back ourselves. Obviously there's times where it's more severe, but other damage can be caused. My daughter had a subluxation last year, and she had a fractured humerus at the same time, had no pain relief, didn't complain she was in pain at all. So this is another problem that we have, that our pain levels are so high, we don't actually always have the pain that somebody without it would have. So that can be a problem for crews and staff. because we could be saying we're not in pain and we could have a fracture and things like that. We have heart problems. I got diagnosed with POTS last year, which is postural tachycardia syndrome, which results in my heart racing. Sometimes for anxiety, obviously that can make it worse, but it does happen all the time. So obviously when they do ECGs and things like that, it doesn't always pick up that there is another problem, because that only picks up the electrics from the heart and not the other stuff that can be going on. We're prone to prolapse of the valves and things like that, which obviously a paramedic wouldn't have the tools to diagnose that. We have really sensitive skin, so our skin can rip really easily. I don't get on with sticky plasters and things like that, which obviously an ambulance crew would cover you with something if you had an open wound. So skin sensitivity is a big deal for crews on scene. And I find it really difficult because obviously they take you off in the ambulance. I'm not mobile without my wheelchair out and about, so obviously the wheelchair doesn't come with me, which causes a huge problem at A&E because I can't get to the loo, I can't move myself around, so that's obviously becomes a problem for us as patients as well. If we're not, if we can remain in our chair, it's really good. Obviously there's not always space on board. Listening to the patient is crucial, so if they're saying that they're not in pain, then they probably are. Obviously listening to them with how they need to be moved, listening to what positions they need to get into, because sometimes the normal positions that the crew would need them in are uncomfortable for us. Obviously pain medication as well with the crews, because we don't react to morphine the same as other people. They could give us a really good dose, but it's not touching us. Local anaesthetics don't work for a lot of patients with Ehlers-Danlos syndrome as well. I have terrible trouble with having cannulas put in, because my veins, where I've had so many over the years, my veins kind of collapse in my hands. So having that done, if it was needed as an emergency, could also be problematic. The key things with somebody with joint hypermobility and Ehlers-Danlos is, if they arrive and they've got that condition, okay, do you dislocate? Because that's the key thing. Not everybody dislocates. Mum doesn't dislocate her shoulders and elbows like I do. So again, moving and handling would be very different between two people. Some people just have cardiac problems, and their skin. So again, they wouldn't have the joint hypermobility. So I think the key things is, if it comes up, asking those questions: do your joints dislocate? Have you got sensitive skin for plasters if you've got an open wound? Like, I can't have anything because it literally just rips my skin. Equally, we're not very good at stopping bleeding. So for a crew, if there was an open wound, they would need to know that you're a bleeder. Not for the sense that we're on blood thinners, we just take longer to stop that bleed with the collagen deficiency. We've got like an emergency credit card, came from the support group. You can just buy them. So both my kids carry one in their book bags at school. It just says this patient's got Ehlers-Danlos syndrome. They may have dislocation, sensitive skin. It's kind of just got listed them key emergency points. But again, crews wouldn't know to look for that, unless that person's unconscious and they're trying to find an emergency contact in your purse. I've got friends that work full-time, don't have the level of pain, obviously, that I have. I think my mismanagement when I was younger has resulted in me deteriorating much quicker. Plus, probably having children has sped up my deterioration a little bit. But I think our younger people coming through with it, getting that support early is crucial. I mean, my kids moan about their physio programs, they moan about their appointments, but actually we're kind of protecting them from getting worse early. We want them to have their hypermobility supported, because that's the point. If it's not supported and the joint's kept in a good range, then they're hyperextending, possibly dislocating, too much. So I've been diagnosed since I was 18, so 23 years, and I still am not under a specialist. I still have nobody manage my illness. I have nobody. I'll see a leg doctor, a shoulder doctor, but as a holistic approach to my whole being, I'm not under anyone, and I never have been under anybody, because there just isn't anyone around to manage you as a whole person, which is really frustrating.